hereby commission this Nutrition Stabilization and Pediatric Complex to the glory of Allah subhanahu wa ta'ala and the benefit of
This short ceremony marks the formal inauguration of Yobe State's largest Nutrition Stabilization Centre, recently built by the International Committee of the Red Cross, ICRC, in Damaturu. The Commissioner, Yobe State Ministry of Health and Human Services, Dr. Muhammad Lawangana, while addressing journalists shortly after the inauguration of the giant facility, says it will go a long way in complementing the efforts of the state government towards improving healthcare services.
On behalf of His Excellency, we commissioned two very great structures, a nutrition stabilization and pediatric medical complex, as well as a post-traumatic center, both constructed in collaboration with the International Committee for the Red Cross.
In his remarks, the Executive Secretary, Yobe State Hospitals Management Board, Dr. Abubakar Yerima, says,
this edifice is built under Stack Nutritional and Stabilization Center, but it is important to note that it goes beyond that, because malnutrition has a kind of a vicious cycle. By the time the person is malnourished, they become vulnerable to infections, and so there is a space for people that are infected with certain kind of illnesses here. They've provided a isolation center, they provided a mental and psychological center, they provided a playground for individuals. So it's an all-encompassing edifice that will holistically look at the patient in total, from the beginning of the acute illness to when the patient is going to be stabilized.
Some ICRC officials who spoke at the occasion say the facility symbolizes the life-saving interventions provided to communities grappling with effects of armed conflicts and food insecurity.
As you may know, we are here for commissioning with authorities these two buildings. And 3 years ago, ICRC working hand-to-hand with health authorities and these centers, as Honorable His Excellency said, going to be referral centers for all Yobe, and it's exactly it has been coordinated and discussed and finally implemented with our WhatsApp team, our health team, and then from Damaturu and Abuja. So I would like, we really appreciate the effort, the joint effort, and we thank also authorities for their support to be able to achieve this project.
I'm very grateful and honored to be here today. I'm usually based in Abuja, but it's a great opportunity that I happen to be here to be part of this celebration of this great and magnificent facility. I want to appreciate all the work that has been done to create this facility, the collaboration between the authorities and our colleagues here in Damaturu. Of course, this is a great structure, also the other one, but I think what is more valuable and important is the services that it will provide.
ICRC is, apart from the health activities, ICRC has other departments that help to assist the vulnerable communities, particularly those affected by armed conflicts. We have the Economic Security Department, we have the Water Department, we also have the Protection Department. So collectively, we provide an integrated approach to help our beneficiaries, particularly those affected by armed conflict.
The International Committee of the Red Cross is working with the state health authorities in the northeast Nigeria in the provision of life-saving treatment and helping to address the alarming levels of malnutrition within communities affected by conflicts, displacement and food insecurity. For YTV News, Muhammad Gambo reporting.